Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, 49 Fertility Center, Banjara Hills. Today I will talk about what to do after an abnormal semen analysis. So as a fertility specialist working in this field more than 10 years, I have come across many patients where we see there are abnormal semen parameters, but they have not taken the action in time and then they could not conceive with their own gametes. So it is very important, if you get an abnormal semen report, you should immediately consult a fertility specialist. Usually what happens is fertility is considered as only female related issues. The female patients attend only the gynecologist, and sometimes even the male workup, which is basic semen analysis, is also delayed for quite a long time. And what happens in this is women lose their peak fertility years. When they are young, they should conceive. So those years are lost because the male evaluation is not done at all, or they come to know about any male factor issue very late. By the time their age has increased, their egg reserve has reduced, which ultimately also reduces the outcome of fertility treatments like IUI and IVF. So it is very important that you take an action in time. So as a couple, if you're not conceived for a 1 year, you should consult a fertility specialist rather than only gynecologist or andrologist, because fertility specialist will consider you as a couple as a patient and not individual patient. So we evaluate the husband and wife both at the same time. So we know all the issues that we might have which can result into infertility. It's never only one issue. So most of the couples may have multiple issues like polycystic ovary along with thyroid issue, along with sometimes prolactin abnormalities, or sometimes even the uterine structure abnormality like unicornuate uterus, bicornuate uterus, septate uterus, along with husband having oligospermia or having problem with the sperm motility or having abnormal morphology in the semen or having high DFI. So there are multiple permutations and combinations which might be possible. So it's important to consult a fertility specialist than considering only gynecologist or andrologist evaluation. So when you visit a fertility specialist, what happens is we evaluate the couple completely. We advise the basic fertility test to the couple, and if we come to know is there any problem in the semen analysis, then we also guide how to proceed further. Some semen abnormalities require further evaluation like hormonal evaluation, sometimes genetic workup, or also ultrasound evaluation. But sometimes it might be just a variation, which is a natural variation. Like somebody has gone through an acute illness or is recovering from a major surgery, and if we are doing a semen analysis within few days of that event, then temporarily the sperm count might be abnormal. Even sometimes viral fevers may affect the sperm count. So such variations are known to occur. So what as a fertility specialist I feel important is, if it is your first semen report, then please make sure that you have got it done in a fertility center where they will evaluate the semen properly as per the WHO guidelines. So this semen report, if it is abnormal, then the fertility specialist will guide you for further testing or might ask you based on your history to repeat one more semen analysis in the center with a gap of 1 or 2 weeks. So after the second report, if that is also similar, then the doctor will advise you for evaluation. Based on whatever reports we get in the evaluation, like any hormonal issue or any infection in the semen or any varicocele, then the doctor will guide you further. So this is about how to handle an abnormal semen report. Usually what I have seen is males tend to take it personally. So this is also a condition which is a medical condition and it is nothing personal. So the medical conditions usually, if it is evaluated in time, will have some solution or treatment. So usually what happens is men tend to take it personally. They do not proceed further with the evaluation for long time, or sometimes they may try just semen analysis at different centers, or they may try some unproven treatments like herbal medications or acupuncture. What happens in this is they lose a very important fertile period of wife's life wherein the chances of conceptions were higher when she's young, and they end up with the fertility specialist when actually the wife is much older, has low egg reserve, and also sometimes what happens is even the sperm count goes down to less than 5 million, or sometimes even the oligospermia patients, they progress to azoospermia where we can't even get sperms from the TISA sample. So to avoid all these complications, it's very important that you take a timely action, consult a fertility specialist. If your semen report is abnormal, then consider going for further evaluation with the fertility specialist. If required, fertility specialist will also refer you to an andrologist, and the plan is made considering couples reports together. It's never only male or only female that we treat as a couple. So it's important that you take action in time rather than wasting the time. So this was about how to proceed with the abnormal semen report. I hope this was helpful. Thank you.